Have you noticed that masturbation after 60 just doesn't feel the same anymore? Maybe it's less sensitive, you feel numb afterward, or you have to squeeze tighter to get that same rush? If you're nodding along, comment yes below, because you are not alone. Most men assume these changes are just a normal part of aging, but the truth is, the cause often lies in common mistakes we're making every day that can actually harm our nerves. Hi, I'm Dr. Kara. As a urologist with over 30 years of experience in men's health, I've dedicated my career to helping men just like you regain their confidence and pleasure, especially after 60. I'm here to share insights you won't find anywhere else. I'm not going to beat around the bush. In this video, I'm going to reveal the 3 biggest mistakes that are silently damaging your nerves. More importantly, I'll teach you a simple but powerful technique I call the safe touch. This isn't just about avoiding injury, it's about unlocking the key to restoring pleasure and sensation. Before we dive in, do yourself a favor. Grab a cup of coffee or tea, get comfortable, because these next minutes could be a game changer for you. And if you want to keep that spark alive and maintain peak performance after 60, make sure you subscribe and hit that notification bell so you don't miss my future videos. Plus, stick around to the very end. I have a bonus for you. A simple daily exercise that can dramatically improve circulation and boost erectile health. Let's get started.
Have you ever noticed that what once felt vibrant and intense now feels a bit muted? Maybe pleasure is harder to find and you feel less sensation than you used to. It's a common concern, and the good news is it's not a sign that something is broken. It's often a natural result of the body's aging process, and we can do something about it. So let's talk about why this happens. As we get older, our nerves and blood vessels, the very things that fuel sensation and erections, begin to lose some of their efficiency. This is due to a natural process called atherosclerosis, which is the narrowing of our arteries. Think of it like a garden hose. Over time, mineral buildup can reduce the water flow. The same thing can happen in our bodies, and when blood flow to the nerves and tissues of the penis is reduced, it can lead to a condition called hypoesthesia, or reduced sensation. Another key factor is testosterone. Testosterone levels in men typically decline by about 1 to 2% per year after age 30, and this can significantly impact nerve function and tissue health. A common misconception is that this decline is only about libido or erectile function. In fact, low testosterone can affect everything from your energy and mood to your memory and overall vitality. Here's the thing, this isn't a one-way street. The lack of sensation can become a self-fulfilling prophecy. When you feel less, you might apply more pressure, which can damage delicate tissues and lead to issues like inflammation or scarring. The key is to understand what's happening and work with your body, not against it. The good news is you can take action. One simple, powerful step you can take at home is to improve your circulation. Just a brisk 20-minute walk each day can do wonders. Regular cardiovascular exercise, as recommended by institutions like the Mayo Clinic, is crucial for keeping blood flowing and nourishing those vital nerves.
You know, it's so easy to fall into old habits. We get comfortable with a certain way of doing things, and we don't even realize it might be causing harm. When it comes to masturbation, many men over 60 make a few common mistakes that can actually reduce sensation over time. It's not about what you're doing, but how you're doing it. Here are 3 of the most common mistakes I see in my practice. Mistake number 1, too much friction. As we get older, our skin and tissues become more delicate, so that vigorous, aggressive friction you might have used in your younger years can cause tiny, microscopic tears. This repeated microtrauma can lead to inflammation and scar tissue, increasing your risk for conditions like Peyronie's disease, which causes painful curvature. Think of it like this. Rubbing a piece of sandpaper on a delicate surface over and over. Eventually, you'll cause damage. Mistake number 2, not using enough lubricant. This is a big one. Many men think they don't need lube, but dry friction is the primary cause of that microtrauma we just talked about. Using a high-quality, water-based lubricant is a simple change that can make a world of difference. It protects your skin and nerves, allowing for smoother, more enjoyable sensation. Mistake number 3 is relying on a single technique. It's easy to get stuck in a routine, but using the same grip and motion over and over puts constant stress on the exact same nerve bundles and tissues. Over time, this can cause localized damage and make your body dependent on that specific narrow stimulus. The good news is that these are easy fixes. Simply being aware of them is the first step. You can immediately start by reaching for a good lubricant and trying to vary your technique. These small, conscious changes can help you protect your nerves, maintain sensation, and keep things feeling good for years to come. I know this might sound a little clinical, but the good news is that we have a lot of control over these things. The goal isn't to scare you, it's to empower you. Next, we're going to get into the practical solutions you can start using today. This is where we shift from understanding the problem to actively protecting your health. Get ready for the Safe Touch technique.
We've talked about the why and the mistakes to avoid. Now let's get to the good stuff, the how. This is about taking control and empowering yourself to enjoy a healthy, pleasurable sex life for years to come. I've developed a simple set of principles I call the Safe Touch to help you do just that. First, be generous with lubrication. I know some guys think lube is just for certain situations, but trust me, it's a game changer for everyone. Use a high-quality, water-based lubricant to reduce friction and protect those delicate nerve endings. Remember, less friction means less microtrauma, which means more long-term sensitivity. Don't be shy with the lube. It's your body's best friend. Next, vary your grip and speed. Instead of a tight, repetitive motion, try a softer, more encompassing grip. Explore different speeds and rhythms. This prevents you from putting constant stress on one area and helps to stimulate a wider network of nerves. It can actually make the experience more exciting and less about just one feeling. Finally, focus on the entire organ. It's easy to get fixated on the tip, but your entire penis has nerve endings. Spend some time stimulating the shaft and even the base. This not only engages a broader range of nerves, but also encourages healthy blood flow throughout the area. By combining the Safe Touch technique with these simple lifestyle habits, you're not just preventing problems, you're actively revitalizing your body, protecting your prostate, and ensuring you can maintain pleasure, confidence, and vitality for decades to come.
We've talked about the why and the mistakes to avoid. Now let's get to the good stuff, the how. This is about taking control and empowering yourself to enjoy a healthy, pleasurable sex life for years to come. I've developed a simple set of principles I call the Safe Touch to help you do just that. First, be generous with lubrication. I know some guys think lube is just for certain situations, but trust me, it's a game changer for everyone. Use a high-quality, water-based lubricant to reduce friction and protect those delicate nerve endings. Remember, less friction means less microtrauma, which means more long-term sensitivity. Don't be shy with the lube. It's your body's best friend. Next, vary your grip and speed. Instead of a tight, repetitive motion, try a softer, more encompassing grip. Explore different speeds and rhythms. This prevents you from putting constant stress on one area and helps to stimulate a wider network of nerves. It can actually make the experience more exciting and less about just one feeling. Finally, focus on the entire organ. It's easy to get fixated on the tip, but your entire penis has nerve endings. Spend some time stimulating the shaft and even the base. This not only engages a broader range of nerves,
but also encourages healthy blood flow throughout the area. This brings us to prostate health. Gentle activity and improved circulation not only benefit sensation, but also support your prostate, reducing the risk of inflammation. This is incredibly important as you get older. By combining the safe touch technique with these simple lifestyle habits, you're not just preventing problems, you're actively revitalizing your body, protecting your prostate, and ensuring you can maintain pleasure, confidence, and vitality for decades to come.
We've talked about what you can do at home, but sometimes a change in your body is a signal that you need to see a professional. It's a common mistake to ignore these signs, thinking they're just part of getting older. But these signals can be your body's way of asking for help, and addressing them early can prevent bigger problems down the road. There are 3 key signs you should never ignore. Persistent pain or discomfort. If you experience pain or numbness that doesn't go away, or you notice a change in the shape of your penis, it's time to see a doctor. These symptoms could be a sign of injury or a condition like Peyronie's disease, which is more easily treated when caught early. New or worsening erectile dysfunction, or ED. While some changes in erectile function can be normal, a sudden inability to get or maintain an erection could be a red flag. As research from institutions like Harvard Medical School shows, ED is often one of the earliest warning signs of underlying health issues, such as heart disease or diabetes. Your sexual health is a window into your overall health, so please don't ignore it. Changes in urination. Many men don't realize that masturbation habits can be linked to prostate health. If you experience a frequent need to urinate, a weak stream, or other urinary changes, it could be a sign of prostate inflammation or benign prostatic hyperplasia, or BPH. The biggest mistake you can make is waiting too long. Early detection can make a world of difference. So, if you're experiencing any of these symptoms, I want you to make an appointment with your doctor. It's about protecting your long-term health, not just your vitality in the bedroom.
Remember this, getting older isn't about giving up pleasure. It's about getting smarter. It's about being more intentional with how you care for your body. What we've learned today is that by avoiding those common mistakes and adopting the safe touch technique, you have the power to protect your nerve health and maintain a fulfilling sex life for years to come. My final piece of advice is simple. Just start today. Don't wait for things to get worse. Start by adding a gentle, brisk walk to your daily routine. This small change in circulation can have a profound impact on everything we've discussed. Your body is resilient and it responds to the care you give it. Be patient with yourself, stay consistent, and remember that taking charge of your health is one of the most powerful things you can do. If you found this helpful, you might be wondering about other aspects of men's health after 60. I'll be back soon with more insights. Until then, stay healthy, and I'll see you in the next video.